7 symptoms of polycystic ovarian syndrome that you shouldn't ignore. Hormone imbalance is the cause of polycystic ovarian syndrome, PCOS. Due to its impact on health, it can greatly affect a woman's quality of life. PCOS is a condition that occurs when small cysts or follicles form in the ovaries and its lining thickens. It tends to occur during adolescence, although it can also develop at other times during the reproductive age. Given that high levels of androgen cause the syndrome, the women who it affects may also suffer infertility. Furthermore, the imbalance can trigger rather uncomfortable syndromes that can impede on living a full and healthy life. Fortunately, once the syndrome is detected, patients are able to access medical treatment that can help control it. Knowing that some women might overlook the symptoms, we'd like to present 6 warning signs of polycystic ovarian syndrome. Freckling. There are multiple factors that lead to freckles. However, when they appear suddenly and in visible areas, a hormone imbalance is a likely cause. Women who have an irregular androgen production tend to have high levels of insulin in their blood, which leads to freckling in the following areas: neck, armpits, face, hands, upper thigh. 2. Troubles with conceiving and infertility. There are some women who have a healthy uterus and ovaries in spite of suffering PCOS. However, in most cases, the condition's first consequence is ovulation reduction, which can later lead to complications in becoming pregnant. The hormone irregularities make conceiving difficult. Even if a woman does conceive, it usually brings about serious complications and risks. These days, however, thanks to advances in medicine, there are several treatments available for inducing a normal ovulation. Weight gain. Unmanageable weight gain can be a symptom of a hormone imbalance which characterizes the polycystic ovarian syndrome. Unfortunately, close to half of the patients with PCOS usually experience weight gain as the problem advances. A healthy diet and regular exercise won't shield you from the syndrome, so it's extremely important to seek medical help to control a hormonal overproduction. Chronic acne. Acne is a skin problem that can vary in severity according its causing factor. Because it's a visible symptom, acne can often lead to low self-esteem and insecurity. In the case of PCOS, the excessive production of testosterone causes chronic acne. In women, this hormone is normally secreted in small quantities. Excessive growth of body hair. Women with polycystic ovarian syndrome usually have hirsutism, or an excessive growth of body hair. Although it's normal for all of us to have some amount of hair in various areas of our body, the thick hair and large amount of hair associated with hirsutism isn't common. High levels of testosterone cause this kind of hair growth because it affects women's skin and hair follicles. Hair loss. There are multiple reasons that could explain hair loss. In light of this, figuring out if the cause is internal or external is critical. In some cases, anemia or nutritional deficiencies lead to hair loss because our hair needs nutrients in order to stay strong. Using certain cosmetic products or heating elements can also result in hair loss by directly weakening the capillary fibers. However, if you notice hair loss in addition to any of the previously mentioned symptoms, we recommend checking to see if there is a relation with polycystic ovarian syndrome. It's important to confirm the cause not only because hormone imbalance affects capillary health, but it can also hinder its absorption of nutrients. Anxiety and depression. Hormonal activity in patients with PCOD usually leads to abrupt mood swings, quickness to anger and irritability. Women with PCOD tend to fall easily in depression and anxiety because its symptoms affect body image, sex life and fertility. We shouldn't take these cases lightly. After all, in addition to medical treatment, they often require psychological help as well. In summary, although the symptoms mentioned in this article can appear in other conditions, it's crucial that we take the time to see if they are related to PCOD. Doctors can detect it through medical tests and after, treat it according to each case.